This month, there is a lot of focus on hearts. We all know Valentine's Day is this weekend, but it's also National Heart Month. And today we're taking a look at whether your state of mind has a connection with the way your heart functions.
9 News medical expert Dr. Kohli is here to talk more about this topic. So the first question here, are there mental health risks that are associated with your heart and heart disease?
You know, it's remarkable. As a cardiologist, I'm just starting to realize how close that connection is between your mental health and your heart. That heart-mind connection that we have, we've taken it for granted. In fact, the studies tell us that people who have depression are 64% more likely to develop heart disease. People who have anxiety are 26% more likely to develop heart disease. And if you have conditions like schizophrenia, it can increase your risk of sudden cardiac death threefold. Bipolar disorder can not only cause problems with the condition itself, but with the medications we use to treat the condition can cause weight gain and metabolic syndrome. So I've really started asking all my patients about their mind as it affects their heart.
There's a condition called broken heart syndrome. I've heard of that. It can be triggered by extreme stress. Talk a little bit about that.
Yeah, so it's very common in women, especially postmenopausal women. In fact, more than 90% of the cases are in postmenopausal women. And it's an extreme surge of stress hormones that essentially paralyzes the heart muscle. Now, thankfully, the paralysis is usually temporary, but any type of extreme stress can trigger this. So death of a loved one, a financial stress, extreme fear or extreme anger, sometimes even a physical illness. I just had a patient with this last week in the hospital who got a stomach bug, and she just got really upset because she hates vomiting, and it triggered this in her. So that's called Takotsubo's, or stress-induced cardiomyopathy, where the stress causes a surge of the stress hormones and the heart just literally stops reacting to pumping normally.
You know, all of our viewers deal with stress in some way, shape, or form, some big, some small. So is stress a risk factor? And I'm going to assume the answer is yes, based on everything you've said so far. Why does stress have such an impact on the heart?
Well, we think true. It's one of the biggest risk factors when it comes to the heart. And in fact, our bodies were not designed for chronic stress. So the way that we evolved was the fight or flight. You see a lion or a tiger, you run away. It's supposed to be a little surge of stress hormones. But the way that we live now, chronic stress, that stress volume is turned up all the time, sometimes at a very high level. So you're talking about stress hormones like cortisol, adrenaline, which can have effects on the body and the heart, make your sugar dysregulated, increase your blood pressure. It can also have effects on inflammation and blood clots. So all those stress hormones make your blood thicker. They make it more likely to have blood vessel inflammation. Then it can have behavioral changes, right? When we're stressed, we don't exercise, we don't eat. We sometimes turn to substances and such. So put all that together, you're talking about, you know, our body's reacting to something that it was never designed for. And that's why there's so much heart disease.
This conversation is stressing me out, actually. just so you know, doctor.
Well, it's interesting because can the opposite be true? Can heart disease patients actually have worse mental health as well?
They can, and I see this all the time. In fact, after a heart attack, 20 to 30% of people will have depression, clinical depression. And some of that is obviously this dagger hanging over your head. You've just had a big heart attack or stroke, and you're like, when is the next one going to happen? But some of it is actually the medications that we use. So medicines like beta blockers, which slow down the heart rate, slow down the force of contraction, can cause fatigue, it can precipitate sexual problems, it can just make you feel sort of like somebody took the air out of your tires. If somebody has heart failure, their heart is not pumping blood as effectively to their brain. That can also make them feel sluggish, slow, and stressed. And then anxiety is huge after heart disease, especially if you've had a cardiac arrest. So I have patients who come back after a cardiac arrest and they're just never the same again. They literally have PTSD from it, especially if they recall any of the part where they woke up.
We're going to go overtime because I want to get this last question in before we say goodbye. For people who do suffer from mental health issues, what can they do to lower their risk of heart disease?
It's so important. And we all have some degree of stress, so I want everybody to listen. If you're in your head, get out of your head and get into your body, right? Moving, doing something physical, focusing on deep breathing, meditation. These have all been shown to lower your blood pressure. In fact, they used to play the harp at the medical ward where people had heart attacks, and they had less arrhythmias, less electrical problems, just from the nice classical music. So I want you to know it's controllable. I want you to know it's modifiable. I don't want you to be scared of it, and I want you to take control of it.
Oh,
that's right.
Can you bring a harp with you next time, maybe?
Next time I will, I promise, for you.
Just a little one right here on the desk. That'd be great. Dr. Kohli, thank you.